Thank you, Governor. Good afternoon, everyone. I just want to say, as the Governor is talking about our next phase together, I just want to say that it has been the absolute honor of my lifetime to serve alongside him in this capacity. I think our commitment to you remains very, very strong. We're fighting every day for both your lives and your well-being and your health and your livelihood as well. And we know that health is so much more than whether we get sick or not. It's so much more about who we are, how we feel. And this has been a very, very trying time for all Ohioans, whether it's us getting sick, someone we know, losing a loved one, or whether it is going through this as business owners and as people who are trying to make our way in the world. In my family, we have people in every walk, from businesses are running to teachers to people like me or my daughter who's on, the front lines right now at Riverside Hospital. This is wearing on all of us, and I just want to acknowledge that, but I do want to give you a sense that while we have a long road ahead, I am very, very optimistic about how we will travel this road together, because I've seen how we've traveled it thus far. So we will be with you once again every step of the way. So let me begin with a little update on our numbers. We have right now in Ohio 8,414 cases. We have now had cases and documented community spread in 87 of our 88 counties. We have, sadly, a total death number of 389. Going to our next slide. We have now tested 74,000 people in Ohio, and we are hoping we are maximizing that capacity, and we are fighting on every front to increase those numbers and have more and more people tested. We have, similarly, our age range is still less than 1 to 101, and we have now a total of 1,729, or 21% of our cases are healthcare workers, and we've had over 2,331 hospitalizations. We also know that long-term care residents have totaled 826 of our cases. A lot is made of this, but we shouldn't be surprised by this data. It's not that hospitals or nursing homes are doing something wrong. It's just, as the governor said, these are very, very high-risk places where more of our populations are that are exposed. The work that is being done is heroic, and we are coming alongside them to do that job well. But I just want to acknowledge that we shouldn't be surprised by those numbers. This is the nature of the virus we're dealing with. I also want to say that we had 623 cases in the past that have been reported in the past 24 hours. We've had 28 deaths in our last time period, and hospitalizations of 221 reporting hospitals, 1,050 people hospitalized currently with COVID-19. I do want to say that the path ahead, you're hearing a lot, and I know it's hard because there's not one exact path, but what our team has been putting together is a series of phases that we'll walk through together as we slowly and responsibly open up and try to bring about more of our life as we know it. And those details, again, the governor and his team and the lieutenant governor will be laying out in the days to come. But there's a lot of things that you can do as we go through the next phase to help us do really well at it again. And not surprisingly, it's a lot of the things we've learned in the first phase. It is, once again, that great hygiene you're doing, going back to the boring basics again. It's the washing of your hands. It's the coughing. And now, again, it will become a new part of our lives, just like taking off our shoes is to go through an airport. It will become using this mask. Do not underestimate donning your mask and donning your cape. I still very much need you to keep doing this and doing it better than ever, because we know as we slowly return to activities, it will increase slightly our chance of spreading infection. So we really, really have to embed in ourselves doing this well in the days to come. This is a very special mask that I'm holding. It was made for me by a woman in Grandview, the area here in Columbus where one of my sons is a teacher, Mr. Acton, as many of you know. And the woman who was making this was running out, as many of you home sewers are, of the elastic that goes around. Somebody was going by. It was a beautiful day. The window was open. And she said hello, and they saw that she was working on this, and they asked if they could donate material. And the material was donated by a lovely young girl who has survived chemotherapy, and the actual ties were from a little tank top she would wear, I think when maybe she had to go get dialysis, actually. And I just want to say this was something given to me. It's precious, and each one of these masks I'm seeing you wear, the ones I'm seeing even our media wear, they're starting to have stories behind them. I'm almost imagining a storyboard behind each and every one of these. This is a big part of our future. You know, we're not going back to life just the way it was before, but we are moving forward in the most amazing ways. And once we accept it, and I'm telling you, everyone, we're accepting this slowly. Every day I go through stages of grief. I go through, denial. I go through a little anger. I go through a little bargaining. I don't have to wear this. I might not need it. This isn't true. I get a little down. And then I come to a different kind of acceptance. And at that stage, I start to imagine how things could be, how they could be better than they've been, how we could do things differently. And just like that Battelle innovation we saw yesterday with that lovely couple who married into, in just a conversation, a new way of being, the businesses we were on the phone with today were coming up with ideas that are going to actually transform our businesses in new ways. And I know our small businesses, who are particularly hard hit, are working on the same kinds of innovations. So I want us to know that we are going to continue, and I'm your doctor, so I have to be telling you, don't be so hard on yourself when you go through these phases day to day, because we're all accepting sort of a new way to go forward. But I want you to go through it, and I want you to don that mask and don that cape and bring to us your best ideas, whether you're a business or a person. Let's keep going into this together. Thank you.